A patient presents to the emergency department with increased, labored respirations, fruity breath odor and a blood glucose of 776 mg/dL. The patient discloses that he could no longer afford his insulin prescription. The patient is prescribed this series of orders. What is the priority nursing action? A. Obtain 4 access. B. Inject insulin glargine, Lantus, 200 units. The nurse is caring for an 80 kg patient at high risk for SIADH. Over a 12-hour shift, the nurse records the patient's urine output. Which of the following volumes would be the minimum expected urine output for the patient? A. 1920 milliliters. B. 240 milliliters. C. 480 milliliters. Which of these is not an anticipated lab finding in a patient with diabetes insipidus, DI? A. Random plasma osmolality 294 mosm/kg. B. Urine osmolality 120 mosm/kg. C. Urine specific gravity 1.030. The nurse is caring a patient for a patient with acute idiopathic thrombocytopenic purpura, IDP. Upon reviewing the lab results, the nurse notes that the patient's platelet level is 10,000 cu/ml. Which of the following events concerns the nurse about this platelet level? A. Epistaxis. B. Purpura. C. Intracranial hemorrhage. A patient with a history of alcoholism and cirrhosis suddenly begins vomiting blood and complaining of lightheadedness. The nurse anticipates which of the following diagnoses? A. Pancreatitis. B. Esophageal varices. C. Fulminant hepatitis. What are the key differences between systemic inflammatory response syndrome, SIRS, and sepsis? A. Sepsis can occur without SIRS. B. Sepsis includes symptoms of SIRS in addition to infection, mental status changes, and/or hypoxemia. C. SIRS is a progression of sepsis. What are the key differences between systemic inflammatory response syndrome, SIRS, and sepsis? A. Sepsis can occur without SIRS. B. Sepsis includes symptoms of SIRS in addition to infection, mental status changes, and/or hypoxemia. C. SIRS is a progression of sepsis. Which of the following orders would the nurse question for a patient with thrombotic thrombocytopenic purpura? A. Prepare patient for plasma exchange therapy. B. Administer prednisone 1 mg/kg daily. C. Administer 1 unit of platelets over 60 minutes. D. Perform neurologic checks every 2 hours. A patient to the emergency department following a motor vehicle accident. The patient has bruising around the umbilicus and radiating left shoulder pain. The nurse anticipates the patient has which of the following injuries? A. Compartment syndrome. B. Splenic rupture. C. Kidney contusion. Which of the following lab results is most concerning for heparin-included thrombocytopenia and thrombosis syndrome, HIT? A. Anti-XA 1.1 UML. B. Hemoglobin 11 GDL. C. 3 Indian rupees. D. platelet count 48,000 mm3. A patient presents to the emergency department with acute, severe abdominal pain. The patient has little to no other symptoms and mesenteric ischemia is suspected. What is the priority nursing intervention? A. Prepare the patient for surgery. B. Administer fleet enema. C. PO challenge. A patient with acute pancreatitis asks the nurse how to reduce their risk for acquiring this condition again. Which response is most appropriate? A. You should try to eat a high-fiber diet. B. Since you have had pancreatitis, you will not get it again. C. You should decrease any alcohol consumption and maintain a low-fat diet. Which of these patients is at the highest risk for hypertensive encephalopathy? A. An 84-year-old male with intracerebral hemorrhage and blood pressure of 180/83. B. A 47-year-old male with chronic hypertension who admits to recently stopping his antihypertensive medication. C. A 35-year-old woman with anxiety and depression. A patient admitted to the critical care for congestive heart failure complains of chest pain and heart palpitations following furosemide, Lasix, administration. Which of the following lab results would the nurse expect to find? A. Mg 1.6 milliequivalent L. B. Ca 8.7 mg dl. C. K 3.1 milliequivalent L. A patient with hypocalcemia may also have which additional electrolyte imbalance? A. Hyponatremia. B. Hyperkalemia. C. Hypomagnesemia. A patient in the critical care unit has a nasogastric tube set to intermittent suction to maintain gastric decompression while being treated for a bowel obstruction. For which electrolyte imbalance should the nurse monitor? A. Hypocalcemia. B. Hypercalcemia. C. Hypokalemia. Which of the following is not an intervention to prevent pressure injury? A. Reposition the patient every 6 hours. B. Place and use transfer sheet under patient. C. Pad bony areas on the body with pillows. D. Apply barrier cream when changing patients with incontinence. A patient presents to the critical care unit for monitoring of a subarachnoid hemorrhage. The patient is experiencing mild focal deficits and is confused. The nurse knows that the patient currently presents in which grade of hemorrhage? A. Grade I. B. Grade 2. C. Grade 3. Which of these is not a criterion of brain death? A. Absence of oculovestibular reflex. B. Absence of oculocephalic reflex. C. Apnea without ventilator support. D. EEG with irregular impulse activity. The nurse understands that which of these bacteria commonly cause bacterial meningitis? A. Streptococcus pyogenes. B. Streptococcus pneumoniae. C. E. coli. D. Staphylococcus aureus. The nurse is monitoring lab work on a patient who is prescribed phenobarbital for seizure activity. The nurse notes that the patient's phenobarbital level is 47 mg/ml. Which of these interventions should the nurse perform first? A. Administer an additional bolus dose of phenobarbital. B. Hold the patient's next phenobarbital dose. C. Notify the prescribing healthcare provider. The nurse is caring for a patient with a pulmonary embolism. The patient is prescribed recombinant tissue type plasminogen activator, RTPA. The nurse knows that this medication is used for which of these purposes? A. To regulate blood pressure. B. To help dissolve the embolus. C. To prevent fluid overload. The nurse is preparing to discharge a 56-year-old patient after DVT treatment. In order to provide the most cohesive discharge plan, the nurse will need to provide the patient with A. Verbal and written discharge instructions. B. Verbal discharge instructions. C. Written discharge instructions. Which of these medications are most commonly used as chemical restraints? A. Analgesics and mood stabilizers. B. Stimulants and antibiotics. C. Benzodiazepines and antipsychotics. D. Antiepileptics and narcotics. A patient with hypothermia secondary to submersion asphyxiation needs to be rewarded to a therapeutic body temperature. The nurse knows that, to provide safe rewarming, the patient must be rewarmed at what rate? A. 2.0 to 2.5 degrees centigrade per hour. B. 1 to 1.5 degrees centigrade per hour. C. 0.5 to 1 degrees centigrade per hour. A patient is admitted to an acute care facility for respiratory distress and COPD. The patient has a FEV1 of 45% of the predicted rate and a FEV1 FVC of 66%. Based on this testing, the nurse knows that the patient is in what stage of COPD? A. Stage I. B. Stage 2. C. Stage 3. Which of these is the most appropriate meal choice for a patient with chronic emphysema? A. Fried chicken, mashed potatoes, green beans. B. Baked cod, cottage cheese, squash. C. Roast beef sandwich, pretzels, stewed apples. The nurse is caring for an intubated patient. Which of the following nursing interventions would be least appropriate for this patient? A. Perform suction as needed. B. Minimize oral care. C. Elevate the head of the bed. A nurse is caring for an 82-year-old female with emphysema. Which of the following respiratory findings should the nurse expect during acute exacerbation? A. Dyspnea only at rest. B. Dyspnea on exertion and at rest. C. Dyspnea only on exertion. The nurse is caring for an intubated 95 kg male patient with ARDS. The nurse is reviewing orders for the patient's ventilator settings. Which of the following orders should the nurse question? A. VO2 100%. B. PEEP 10. C. Tidal volume 700 milliliters. A patient with heart failure is at highest risk for which of the following pulmonary complications? A. Pulmonary hemorrhage. B. Exudative pleural effusion. C. Transudative pleural effusion. What does the finding of spine sign on Norman's chest X-ray indicate? A. Pre-existing spinal injury. B. Kyphosis. C. Pneumonia. D. Scoliosis. Which of the following is included in the etiology of idiopathic thrombocytopenic purpura, IDP? A. Splenomegaly. B. Hepatomegaly. C. IgG autoantibodies. Of the following, which is not a consideration when administering IVIG therapy? A. Brand of IVIG product used. B. Patient's socioeconomic status. C. Access to emergency medications. If the bowel sounds are audible when auscultating Matthew's lungs, what injury may he have sustained? A. Ruptured spleen. B. Ruptured liver. C. Diaphragmatic injury. If a patient sustains acute renal failure, ARF, secondary to cardiogenic shock, what type of renal failure is this considered? A. Intrinsic. B. Prerenal. C. Postrenal. Which of the following patients is at highest risk for transfusion-related acute lung injury, trolley? A. A 27-year-old female in respiratory failure secondary to pulmonary infection. B. A 67-year-old female with sickle cell anemia and hemoglobin 5.3 GDL. C. A 45-year-old male is acute hypovolemic shock after blunt thoracic injury. The nurse initiates a transfusion of red blood cells for a patient in acute hemorrhagic shock. The patient develops dyspnea, hypotension, and hypoxemia. What action should the nurse perform first? A. Administer PRN diphenhydramine, Benadryl. B. Stop the blood transfusion. C. Initiate 1000 milliliters NS for fluid bolus. There are several quality outcome indicators that can be expected as a result of the AACN synergy model. Which of the following is not one of the quality outcomes? A. Improved critical care admission screening. B. Increased patient and family satisfaction. C. Improved adherence to discharge plans. An interdisciplinary care conference is held regarding a patient's care in the care unit. The plans from this conference are then presented to the patient to allow for his input. This is representative of which ethical principle? A. Beneficence. B. Autonomy. C. Justice. A nurse receives an order for her patient with acute aortic dissection. The order reads, administer esmolol 50 micrograms kg min 4. Increase or decrease PRN for systolic blood pressure of 120 millimeters of mercury. Which of the following is the most appropriate nursing intervention? A. Clarify order with the prescribing provider. B. Refuse to administer the medication. C. Begin esmolol infusion and titrate as indicated. The family of an 82-year-old intubated patient asks the nurse if the patient will ever be able to breathe on his own again. Which statement by the nurse is most appropriate? A. It may be to tell if he will breathe on his own again. B. At his age, the likelihood of recovery is unlikely. C. I'm just finishing up here and I'll be out of your hair. A patient with previous stable angina has been increasingly complaining of chest pain during both rest and exertion. The nurse would anticipate preparing the patient for which cardiac testing? A. Cardiac catheterization. B. Magnetic resonance imaging, MRI. C. Electrocardiogram, ECG. Which phase of the cardiac cycle does the intra-aortic balloon pump inflate? A. End of ventricular diastole. B. Beginning of ventricular systole. C. Beginning of ventricular diastole. D. Beginning of ventricular depolarization.